Good evening and welcome to another edition of our COVID-19 pandemic update on Channels Television in collaboration with the Ford Foundation. I'm Millicent Walker. Here are some of the highlights this hour. Today, we take a look at the top 3 states with the coronavirus in Nigeria. Kano State in focus and its efforts to battle the virus amidst rising death toll. In Bauchi State, church services and Friday prayers will be allowed to hold Muslims to observe Eid prayers and markets daily, but with a caveat that's adhering to the precautionary measures. And Brazil reports more than 1,000 deaths in a single day from COVID-19 for the first time. And so it's a curious case for Kano when we first heard about the number of mysterious deaths in a week, and later the Presidential Task Force on COVID-19 said it was investigating the cases using verbal autopsy and otherwise, and yet some of those cases were attributed to COVID-19. Since then, those unexplained deaths have been witnessed in other states in the northern region, but that is for another day. For today, let's focus on Kano. A little bit of background. We understand that 73% of the population in Kano live in rural areas with it's about 20 million population, and the poverty rate is about 55%. Now, 57% of that population is under 18. Now, we have more figures coming in from Kano, but when we look at it in terms of the number of affected states, the top 3 states with more cases of COVID-19 in Nigeria, Lagos is on top, followed by Kano, and then Abuja is coming up next. But what we're noticing is the number of deaths Kano is witnessing. When you compare it with the number of cases, talking about 842 confirmed cases, to Lagos's 2,755. Now, also more on that, we're seeing that the number of confirmed cases and number of deaths, looking at the dates. Now, beginning from April the 11th, the first week, to where we are now, it's seen a sharp rise between May the 2nd and today, May the 20th. Health professionals have had a thing or two to say with regards to the breakdown in terms of the number of those that have died in Kano. And we'll take you to what we're hearing with regards to figures coming in, indeed, from the breakdown of the number of doctors that have been affected. And now, from the total, the Nigeria Association of Resident Doctors, they're saying we have about 39,000 doctors in Nigeria. The number of those infected out of that total number is 179. Those that have recovered, 39, but they're still witnessing a number of fatalities, and that is about 5. And this is, when you compare that to what the World Health Organization is saying, the number of doctors that we should have per the number of Nigerian, and so we are falling short behind that. But then, in Kano State, Kano has witnessed the number of health workers contracting the virus. Let's look at Aminu Kano Teaching Hospital, and those are the figures there. The number of doctors, the nurses, the technicians that have contracted COVID-19, and there you also have the National Orthopedic Hospital in Dala in Kano, also that figure totaling 91. So we really are seeing a sharp rise in terms of those health workers who are contracting COVID-19 in Kano. But we're going to take a closer look at, indeed, why it appears the fatality rates between Lagos and Kano appears to differ. Lagos' fatality rate is about 1.38%, while Kano is 4.28%, and this is according to the Nigeria Center for Disease Control. We would be, of course, getting a medical practitioner to join us to talk about what indeed this means. But first, the total number of confirmed cases in Nigeria confirmed COVID-19 cases is at 6,401 after latest announcements by 226 yesterday by the NCDC. The new infections were recorded in 15 states and the Federal Capital Territory. Till date, 1,734 patients have been discharged and 192 deaths recorded in 34 states and the FCT. A breakdown of the figures by region shows Lagos in the southwest with the highest number of cases with 2,755, followed by Kano in the northwest with 842. In the north central region, the Federal Capital Territory has the third highest tally with 427. Borno still tops in the northeast with 227 cases. Edo leads in the south-south with 119 and Enugu in the southeast with 16 cases. Now, Bauchi State Governor Bala Mohammed has eased the lockdown imposed on the state and he has relaxed the ban on religious worship effective from Thursday, the 21st of May. From now on, church services, Friday prayers will be allowed to hold. Muslims will observe the Eid prayer. And markets will be opened on a daily basis, but with a caveat, people must continue to adhere to social distancing rules and take other precautionary measures against COVID-19. This decision arose from a stakeholders meeting earlier today. The governor warns that Eid celebration must be low-key and traditional horse riding, the Durbar, has been cancelled.
On behalf of the stakeholders and the people of government of Edo State, I wish to convey the following decision that the partial lockdown imposed on the state is relaxed and the relaxation would afford the people of Bauchi to attend their places of worship, the Friday worship, the Eid grounds, and the churches. But in doing that, they will continue to practice social distancing and all medical measures, including wash of hands and wearing of masks. And that the lockdown, total lockdown in Azare, Katagum, Zaki, and Giade is also relaxed. As from Thursday morning, all people are free to go out their normal businesses, but exercising the following measures. That people coming out will wear masks as a matter of necessity and as a matter of corporate social responsibility on everybody. Government will provide what it can provide to the vulnerable and disadvantaged people and those performing critical duties.
Well, let's go into talking about the curious case of Kano and why it means or what it means for healthcare workers and why they're contracting the virus. Joining us from our Abuja studio is the Nigeria Association of Resident Doctors President, Mr. Sokumba Aliyu. Thank you for joining us on the program. First, what would you say is mostly the cause of the number of health workers contracting COVID-19? And perhaps we'd like to begin with the numbers we're seeing from Kano.
Thank you very much. Just last week, myself and other union leaders were in Kano to see for ourselves firsthand what's going on in Kano, and we were fortunate to see the leaders, the chief medical directors of Aminu Kano Teaching Hospital, the National Orthopedic Hospital, and then the Muhammad Buhari Specialist Hospital. We had an extensive interaction with them, and we also interacted with the healthcare workers there during the solidarity visit. During the visit, we were made to understand that at the outset, the inception of this COVID-19 outbreak in Kano, there were a lot of things that could have been done better that were not done as appropriately. And one of them was the fact that at the outset, there was the initial denial of the death toll recorded in Kano being attributed to COVID-19. And that's because of the initial delay in recognizing the outbreak in Kano and instituting appropriate and other necessary measures in Kano. the delay was partly responsible for the further spread of the disease in the state. And secondly, the inadequacy of the personal protective gears in the hospital, various hospitals in the state, because of the poor preparedness of the state was also one of the factors that contributed to the spread of the disease, and to such a point that it affected the healthcare workers in the state. Third factor that contributed to this disease spread affecting healthcare workers is the fact that the populace themselves had poor attitude towards the disease itself. Most of the people in the states hardly believed the existence of the disease, and so they never sought care early, and they, to some extent, were concealing some vital information from those that were offering healthcare to them. But most of these incidences actually happened during the early phase of the disease outbreak in the state. But subsequently, there was this ministerial task team that was sent to assist the Kano state government in combating the disease. And with the arrival of the team and other well-meaning Nigerians who contributed towards the containment of the disease was to some extent brought under control. And we were glad to be informed that the personal protective wears that were hitherto not available sufficiently in the states were made available, and the initial infection prevention control and treatment training that was not widespread was also improved upon. And I believe part of the reason we had a problem in Kano was because
in what you're explaining, I must quickly jump in here to ask you, because we heard at one time that medical doctors were absconding from hospitals in Kano. Is that still the case?
Well, that is not correct. To start with, medical doctors in Kano were expressing concern over the non-availability of personal protective wears, but at no point were they absconding from seeing their patients. And I must say that they have continued to render their services. I'm sure you will corroborate that by the fact that they got infected along the way. So all of that happened when the initial phase of poor arrangement and poor planning was going on, but subsequently that was well handled and things returned to normal.
Do you also liken the way things are now in terms of finding as reason as to why we're having a death toll coming from Kano that's as high as that of Lagos? And when you compare the number of active cases, there's a whole lot of difference. Would you say it's the treatment, or perhaps the way things were before the intervention of the Presidential Task Force team?
Well, though some efforts have been made towards containing the disease, but there's still a lot more to be done in the states. First of all, the risk communication campaign is still poor. So there's still people in Kano who don't believe the existence of this disease, and because of that do not seek care early. And the prognosis of this disease is largely dependent on at what stage do these patients, this COVID-19 patient present to the hospital. Those who present to the hospital early enough are identified and treatment instituted as early as possible. And for those people, they have good outcome. Those who don't present to the hospital immediately, they have symptoms and wait until they develop the severe form of this disease, tend to have poor outcome at the end of it. So because most of the people still have problem with the awareness and understanding of this disease in the state, they present to the hospitals lately, and when they do, the chance of them getting out of it is poor, and that is largely responsible for the poor outcome and the large mortality recorded in the state. Secondly, the political commitment, though it has improved over what was before the concerted effort was made to contain the disease, but still a lot to be done. Just recently, the governor of the state had also joined other governors in the northern part of the country to ease the lockdown, though this they consider as the most appropriate measure at this point. I will say that is rather premature, and this also will go a long way in further spreading the disease, and we are hoping that at the end of it all, this spread will be within what we can contain and manage as healthcare workers. So basically, we still have a long way to go with dealing with the health-seeking behavior of people in Kano State if we are to have a better outcome than we have right now.
All right, we'd like to appreciate your time, Dr. Sokumba Aliyu. Thank you so much for joining us, and indeed keep up the fight as a frontline worker in this pandemic. Thank you for joining us.
Thank you very much for having me.
Let's take a break now. When we return, we'll be asking a public health expert as to some of the measures being taken with relaxation in some parts of the state. Please join us again. Welcome back. And Edo State is currently the highest in the south of Nigeria, with 119 confirmed cases of COVID-19, 75 of which are active, 35 discharged, 6 deaths recorded as of today. Well, the Ministry of Health is sealing off some pharmacies and medicine stores in the state capital. This is for failure to comply with the state government's directives aimed at curbing the spread. The Director of Pharmaceutical Service, Edo State Ministry of Health, who led the monitoring team, listed the precautionary measures for the pharmacies to include the provision of hand washing materials, soap and water at entry points, as well as the use of face masks by personnel. But let's touch base with our correspondent, Collins Osai, who is in the state capital, who has more updates coming in from the state.
In Benin City, the Edo State capital, the government is trying to battle the pandemic by taking several measures that it has put in place. One of which is that the government targets to screen no less than 500,000 residents in the next few days before the end of the month. The government has also relocated the markets from the usual positions where they were to the nearest primary schools so that it can enforce a social distancing and also abide by the protocols put in place by the NCDC in order to battle this pandemic. Again, it's the issue of border closure. That was one of the first steps that the state government took here in Edo State. The government closed these borders and manned them with health workers who screen residents who are coming in or travelers who are passing by, to screen them of the coronavirus, to check out for some of these symptoms before they are either allowed into the state or pass through the state. And also, while this is also going on, the curfew was imposed. Initially, the dusk to dawn curfew was to begin from 7 p.m. to 6 a.m. the following day, but now it has been relaxed a little bit to 8 p.m. to 6 a.m. and that curfew is still in place at this moment. The government is also taking the issue of awareness and sensitization very serious, because according to it, it said that is how they can be able to manage the issue of community transmission of this disease. So from Benin City, the Edo State capital, Collins Osai, Channels Television News.
All right, thank you, Collins. Well, for more on tackling COVID-19, I'm now being joined via Skype from Surulere, Lagos by an Associate Professor of Public Health, Dr. Kemi Odukoya. Thank you for joining us on the program. I'd like to begin with what's happening in Edo State. The news about pharmacies, the clampdown on pharmacy stores, patents, medicine shops, and this is over non-compliance of precautionary measures. We're seeing this across states with regards to how to stop or reduce as much as possible community transmission. What's your take with some of these measures and insistence on these precautions?
Thank you. The objective of public health measures against COVID are to make sure that we reduce community-based transmission. Now, while we need to understand that pharmacy shops, patent chemists, patent medicine vendors are considered essential services, but these are also places that are potential points of spread. Because when people fall ill, and we do know that some people might have mild symptoms with COVID, we have to understand that in Nigeria, the healthcare seeking behavior, some people might are more likely to go to chemists or to pharmacies even before they get to the hospitals. So it's important that in these places, we do not end up having increased community transmission. So while these are essential services on one hand, there are also potential points of spread on the other hand. So it's important that the principles of infection control are adhered to in the community pharmacies.
Staying with different state government measures so far, the Bauchi state governor has relaxed lockdown, worship centers, and effective from Thursday. But he said there will be a caveat, and that is the precautionary measures, the safety protocols must be adhered to. Do you see any challenge in this? How do you think the government would check that indeed all of these guidelines are adhered to?
Yes, many governments, maybe based on socioeconomic reasons or political reasons, or sometimes they feel forced to have relaxing of the lockdowns. But we need to remember that many of these public health measures are to reduce community transmission. So it's difficult to enforce some of these things. So the government is kind of like torn between two. I would say that it's better to be safe than sorry, and the idea would be, as much as possible, let's reduce human to human transmission as much as possible where necessary. However, if the government does feel the need to relax or ease some of these restrictions, it's important that measures are in place to make sure that these do not become potential points of exponential increase in number of cases. Otherwise, at the end of the day, it really wouldn't be worth some of these apparent relaxations.
All right, we appreciate your time. Thank you, Dr. Kemi Odukoya, Associate Professor of Public Health. Thank you for joining us on the program.
Welcome. Thank you for having me.
Brazil is back on the COVID-19 death toll map as it records more than 1,000 deaths in a single day. For the first time, amid warnings, the outbreak is weeks away from its peak in the country. It also has the highest toll in the number of cases in Latin America, now reaching 271,628 confirmed cases, which is likely to go higher because of insufficient testing. But figures are pointing to the president for repeatedly playing down the risks of COVID-19.
Brazil has recorded its highest daily rise in infections and deaths since the coronavirus outbreak began in the country. Health officials reported a further 17,408 cases and 1,179 deaths in the past 24 hours. Peru's daily infection rate for coronavirus hit a record 4,550 cases as the South American nation edges near a total of 100,000 COVID-19 patients. Peru has been one of Latin America's worst-hit countries in the pandemic. Despite implementing tough lockdown measures, Lima has struggled to flatten the curve of new infections. South Korea reported 32 new cases on Wednesday, taking the national tally to 11,110, with 263 deaths, as schools opened for the first time this year. Prime Minister Chung Shin-kyun urged officials to block risk factors from reaching the campuses as high school seniors began returning to classes. However, more than 60 high schools have ordered students to go home immediately after 2 students were tested positive. And residents of Bolivia's Cochabamba are demanding an end to the country's coronavirus lockdown, saying quarantine has left them without food and money. Bolivia is amongst Latin America's poorest nations, with many families relying on day-to-day informal work to make ends meet. But with restrictions on movement, these residents say they have been left destitute by quarantine and want to return to work.
The Nigeria Center for Disease Control continues to work closely with states. You can find the latest national strategy to scale up access to coronavirus disease testing in Nigeria and other public health advisory. The website comes alive with all the information, statistics, with regular updates on the guidelines. Let's take you to the live feed of the World Health Organization's website. Each moment, there are regular updates about the spread of the pandemic. WHO's global strategy guides the public health response at national, subnational levels, including practical guidance for strategic action that is tailored to local context. You can take a look at some of the numbers in real time. Well, that's our COVID-19 special edition on Channels Television in collaboration with the Ford Foundation. Thank you for watching. I'm Millicent Walker. Until next time, wash your hands and wear your face masks.